single payer quickly. Number one, everybody in, nobody out. This is supported by 81% of all Californians. A single payer bill was passed by the California legislature a couple years ago. Governor Schwarzenegger, thinking he was in another action film, vetoed it. Number two, portability. Even if you are unemployed or lose or change your job, your health coverage goes with you everywhere. Number three, uniform benefits. No Cadillac plans for the wealthy and Pinto plans for everyone else. There are no high deductibles, caps on payments for care, no protection in the event of a catastrophe. In other words, it's one level of comprehensive care for everybody. Free choice of hospital and physician, which most people don't have in this country. They're assigned a network of physicians and a hospital by the HMOs. Prevention. When you have a single payer, you have a database where you can develop outcomes, and you can learn quickly what works, what doesn't work, what bad medical procedures are used, what better medical procedures are used, what drugs are effective for the purposes for which they're advertised, but they have a bad side effect compared to drugs that are effective for purposes for which they're advertised that do not have such a bad side effect like gastrointestinal bleeding. You end the insurance industry's interference with care. The insurance companies do not deliver health care. They deliver customers. And if we want to reduce the corporatization of medicine and return professional judgment to the medical and nursing professions under rigorous standards of accountability, we must separate that domination of healthcare decisions by the health insurers. It would reduce, as I say, administrative waste, engage in cost savings that I've mentioned, and it would lead to a greater public oversight if it gives a structured role to consumer groups to be vigilant and a monitor. That's the key thing that even H.R. 676, which is a single-payer bill in the House of Representatives with 83 members of the House of Representatives supporting it, the most recent one being Russ Holt from the Princeton area. It doesn't have enough attention on giving the consumers, the patients, the kind of oversight, monitoring that is the ultimate safeguard for a public health insurance system. Now, the projection is that we will hit 50% of our economy on healthcare expenditures in 50 years. 50% of our economy will be devoted to healthcare expenditures if we do not turn it around. Now, the health insurance industry and the drug industries, most benignly, cannot save themselves. They're in a competitive racket in the drug industry where they have to find the latest Me Too drug, try to patent it on some minor variation of innovation in order to counteract their opposing drug companies' drug. Increasingly, these are redundant therapeutic drugs, and they're big sellers because they're heavily advertised on TV. And increasingly, the breakthrough drugs and the vaccine drugs are not receiving sufficient attention. 3 years ago, I was with the head of the National Institutes of Health, a very distinguished physician, and we were around the table discussing matters, and he turned to his assistant and he says, "Are you getting the same impression I am that the drug companies are not interested in vaccine development?" And he said, "Yes." Well, they will be interested if you subsidize them with your own tax dollars, which is what is happening. But not on their own, not with their own profits. Enormous amount of money, advertising and promotion, is devoted by the drug companies to these increasingly less and less significant products in their competitive race with one another. And where they don't want to compete, they buy each other up, and increasingly the drug companies are severely concentrated and are ripe for antitrust action by the Justice Department. Let me conclude on this note. Whenever our country wants to consider major redirections, isn't it a good idea to have a fulsome public debate? Isn't it a good idea that we have our own radio and TV stations? Isn't it a good idea that we have our own cable networks? Why have we surrendered all our radio and TV time and all our cable networks to corporations who use our own property, which is the public airwaves, for nothing and decide who says what 24 hours a day? There are very distinguished, experienced physicians and professors of medicine who want to be part of this health insurance debate, and they can't get any time on the news, on the talk shows, on the radio shows, on the Sunday talk shows even. So it's up to us in our living rooms, in our universities, in our village squares, as the metaphor goes, in our town meetings, to learn and discuss about how we want to go in this year of decision. The way it's going, my guess is that it's not going to be a very good resolution for the American people. They will have a few tweaks on the health insurance contracts, which are all fine print. They'll say you can't deny people for pre-existing conditions. Therefore, pregnant women will no longer be denied health insurance on the grounds that pregnancy is a pre-existing condition. This is why Europeans laugh at us. They cannot believe it. Pregnancy is a pre-existing condition. So they'll get that through. Then they'll say, well, you can't lose your insurance if you get sick. Yeah, but the industry knows how to circumvent that. They fiddle with the deductible. They raise the price. That's the level that Congress is at now. Oh, they're going to be tough on illegal immigrants and federal funding of abortion. They'll crack down on those. But how about replacing a very wasteful, a very cruel, a very non-prevention oriented health insurance system with one that treats people's health as their first and only priority, with proper cost and quality controls. That is a sticking point for all health insurance. There's got to be quality and cost controls, which are much easier to implement than when you're dealing with such a variety of powerful lobbies and hundreds of insurance companies and drug companies and commercial HMOs, etc. In many ways, what we're seeing here is another round of failure, and that means that in a few years, the whole issue will be revved up again because the costs are going to go out of control. There is no cost controls that are going to work in this bill or these bills, whatever may be in them, in Congress now. The so-called public option, imagine calling something a public option instead of public choice. I don't know who does the language for the Obama administration, but the public option looks like it's going to be defeated because its own sponsors keep saying, well, we're for a public option, no, we're for a Medicare choice for people who can't afford otherwise. We're for a public option, but that doesn't mean we're going to reject the bill if it doesn't have one. The minute you say that in Washington political circles, you've given up on the public option. And it's been said again and again by President Obama, his spokespeople, and some leading members of Congress. So that's all we're going to be left with is perhaps 40 million new customers for the health insurance industry and more customers for medicines and skyrocketing costs. Now, if we don't get angry about this, we have dropped out of democracy. If we don't get angry about this, we have no confidence in the sovereignty of the people to reassert control.